يا اوكي. اوكي. مم. بسم الله الرحمن الرحيم. حضرات السادة الكرام، السلام عليكم ورحمة الله وبركاته. نيابة عن معالي رئيس مجلس إدارة جمعية إبصار الخيرية الدكتور أحمد محمد علي وكافة منسوبي الجمعية، يسعدنا أن نرحب بكم في انطلاقة ورشة عمل الاكتشاف المبكر لعيوب الإبصار لدى الأطفال. وهذه الورشة العمل اللي هي باكورة انطلاقة حملة إبصار الوطنية للاكتشاف المبكر لعيوب الإبصار لدى الأطفال، الحملة اللي بحمد الله يرعاها صاحب السمو الملكي الأمير طلال بن عبد العزيز آل سعود يحفظه الله، عبر برنامج الخليج العربي للتنمية ومجموعة البنك الإسلامي ومستشفيات ومراكز مغربي ومؤسسة الملك خالد الخيرية، بالإضافة إلى الإشراف المباشر مع وزارة التربية والتعليم عبر اللجنة الوطنية للطفولة برئاسة صاحب السمو الملكي الأمير خالد الفيصل يحفظهم الله جميعا. قبل أن نبدأ في ورشتنا هذه المباركة، أود أن أشارككم جميعا برفع أحرى التعازي في وفاة خادم الحرمين الشريفين رحمه الله الملك عبد الله بن عبد العزيز، فنعزي الشعب السعودي جميعا والأمة الإسلامية ونعزي أنفسنا، ونسأل الله له المغفرة وأن يجبر أهله وينعم عليهم بالصبر والسلوان في مصيبتهم وأن لا يركهم مكروه، وينعم علينا بخير عوض لخير ما سلف. فاللهم اغفر لهم جميعا وانعم علينا وعلى هذه البلد بالأمن والأمان، وأسأل الله العفو والغفران لنا أجمعين. في هذا اليوم المبارك ننطلق انطلاقة نحو خطوة جديدة نطلقها لأول مرة في منطقة الشرق الأوسط، بإجراء تدريب الكوادر على الاكتشاف المبكر لعيوب الإبصار لدى الأطفال باستخدام أحدث التقنيات المبتكرة عالميا في هذا المجال، وذلك بهدف الحد من العمى الممكن تفاديه من خلال التخلص من اكتشاف أمراض العيون اللي تؤدي للعمى وبالإمكان التخلص منها مرحلة مبكرة خصوصا عند الأطفال. وبإذن الله من خلال ورشة العمل هذه اللي حتنطلق ساعة ويشرفنا بها هيئة علمية متخصصة من الولايات المتحدة الأمريكية ومن المملكة العربية السعودية والهند، حنكون اكتسبنا مهارة الاكتشاف المبكر لعيوب الإبصار لدى الأطفال بالوسائل التقنية، ونأمل أن كل الحاضرين هنا حيكونوا ضمن شركاء لنا في هذه الحملة، حيث سيتم الكوادر التي تتأهل حيكون مطلوب منا تدريب الآخرين وأيضا ممارسة الكشف المبكر في المدارس على عموم المملكة العربية السعودية على مدى العامين القادمين بإذن الله تعالى، ونأمل أن الناس اللي سجلوا أسمائهم حيكونوا معنا في هذه الحملة. في الختام أود أن أعتذر على التأخير اللي حصل في البداية لأمر خارج عن إرادتنا، وأقدم لكم الأستاذة كارين سايدمان من الولايات المتحدة الأمريكية، عضو مشارك لمجموعة النورث ستار فيجن اللي حتدير ورشة العمل وتقدم لكم الهيئة العلمية وأهداف وبرنامج الورشة. فأتمنى لكم إن شاء الله وقت مبارك، والله. وأختم كلمة القصيرة هذه بأن أسأل الله أن ينفعنا بما علمنا ويعلمنا ما ينفعنا، وآخر دعوانا الحمد لله رب العالمين، والصلاة والسلام على محمد صلى الله عليه وسلم أجمعين. والسلام عليكم.
Assalamu alaikum. Ahlan wa sahlan. Ismi Karen. That's it. That's all I got. I want to welcome you all to this workshop on I Spy and on the EBSAR National Campaign for Early Detection of Eye Diseases in Children. We are so excited to see so many people who are interested in this topic, and I hope that we have planned an interesting afternoon for all of you. We lost a little bit of time getting set up, but we're not going to lose any of the valuable information that we want to share with you. Now, as Mr. Bello said, my name is Karen Seidman, and I am a founding partner of the organization called North Star Vision Group. We have been working with the EBSAR Foundation for many years to help with things like professional training, infrastructure development, service delivery models, and advocacy on behalf of people who are blind or visually impaired. So we're really very pleased that we've been asked to help to organize this workshop and to help in the workshop delivery. So what I want to do is to tell you what the plan is for today, what we're going to be doing. We're going to hear from several experts about the EBSAR project, the EBSAR campaign, and about the I Spy technology for screening children's vision. We're going to learn why vision screening is so important to children's development, and also how the I Spy vision screening software relates to the global efforts that are going on right now about preventing vision loss in children. We're going to have a live demonstration of I Spy by its developer, who you'll meet in a little bit. And here's the really fun part. You will each have an opportunity to try I Spy for yourself and see what it's like to use this quick and easy screening tool to assess a child's vision. You're going to hear about the effectiveness of I Spy and the impact it can have on the vision of children in Jeddah, in the kingdom, and in the region. And finally, you will learn about the EBSAR National Campaign for Early Detection of Eye Diseases in Children, and how each of you can play a part in this very important campaign. And of course, there will be some time for questions. And I do want to mention that certificates of your attendance will be available at the end of the program. Okay. Now, before we start with the talks, I would like you to meet the faculty. In addition to Mohamed Tawfiq Bello, who you just met, I would like you to meet Dr. Marianne Lang, who's at the table. Dr. Lang is my colleague and a founding partner of North Star Vision Group, based in New York. Over at the table, over here, we have several other faculty members. And if we could put a camera on these folks, I will introduce them one by one. Okay. We have Mr. Richard Terendi. Rich, raise your hand. Yeah, there we go. Okay. He is the CEO and co-founder of Vision Quest 2020, from which I Spy Vision 2020 comes. He's a software engineer and the developer of I Spy. Mr. Chris Greening is the, oops, Mr. Chris Greening is missing. Okay, we'll skip Chris, we'll come back to Chris. Dr. Safraz Khan has been very important to the development of services at the EBSAR Foundation, and he's a consultant in low vision care at the Swarup Eye Hospital in Hyderabad, India. Dr. Ahmed Musa is an epidemiologist and biostatistician in the Department of Ophthalmology at King Saud University in Riyadh. In addition, we're going to have the help of several very important people, important to the project and important to services that visually impaired people receive. Is Radi here? Yes. Radi Al-Shaban is the blind unit supervisor at the Center for Special Education at Al-Hassa. He's an orientation and mobility instructor. And we have Hani Al-Roheli, who is the medical coordinator of the EBSAR National Campaign. So I'm very pleased to welcome the faculty. I am very pleased to welcome you all, and I hope we can have a very productive and interesting afternoon together. So our first speaker today is going to be Dr. Marianne Lang, and she's going to give 2 short talks. First, she's going to talk about how this project, the EBSAR project, fits into the global goals of blindness prevention. And then she's going to talk about the impact of vision loss on children. So, Dr. Lang. Just hit it again. There we go. Thank you.
Isn't it wonderful when technology works? I get very anxious before it all starts to come together. I once did a presentation and I was so ready and the ballroom was filled with people, everything was going fine, and they had a big electrical cable going down the middle of the room connecting everything. And just as I began to speak, the cable burst and sparks like fireworks came shooting out all over the place and everything. And I said, that's how to really start a presentation, right? Got your attention now. But I'm very happy to be here today and to be part of this project. And you might be asking, we came here to be in a workshop. Now, why is this woman talking about the power of a shared plan? What difference does that make? And perhaps it's because I'm small. I'm a small woman. I'm not very physically strong, but I often have very big ideas about problems that I'd like to solve. Now, I don't have the strength to do them sometimes. I don't have the tools or know how to use some of the tools. And so I know that I have to have a group of people to work with me. And if I put together a plan with other people, I know that I will have tremendous power with a shared plan to accomplish goals. And so today, I'm going to be talking to you to start this about how we, you and I and everybody in this room, can be part of a shared plan that can make an amazing difference in the lives of children. Not just the children you see from day to day, but hundreds of children, thousands of children, and millions of children. So let's look at what the situation is that we're facing, because when I get my plan together and I'm working with someone, the first thing I have to do is make sure we all understand what the problem is that we're facing. Where is my technical person who's moving my slide? See, here's the technology. I'm known for this. Every time I do a presentation, the technology fails me. Sometimes when the technology stops, Karen and I, who have done a lot of work with children, say, it's time to bring out the puppets. Good, it's great. Okay, so here's the size of the problem we're facing. This is a big problem. According to the World Health Organization, they estimate that there are 39 million people worldwide who are blind and 285 million people who are visually impaired. So we've got a big problem. And 80% of visual impairment, including blindness, is avoidable. So if we've got a problem that is avoidable, what's going on? So let's look at this. The most striking thing, I think, is the main cause of visual impairment in the world is uncorrected refractive error. 42% of that, uncorrected refractive error. And of most importance, restoration of sight and blindness prevention strategies are among the most cost-effective interventions in healthcare. So something is wrong here. These data reveal an enormous problem, but also considerable evidence that the problems of refractive error and other eye diseases can be reduced with existing treatments. The expansion, mobilization, and coordination of resources holds the key to ensuring that people with eye diseases in all parts of the world have the care they need. So many of you may know that there is a plan that has been developed to carry out what is an attack on this vision problem. And it's called Vision 2020, The Right to Sight. It's a global initiative, and it hopes to eliminate avoidable blindness by the year 2020. And it was jointly launched by the World Health Organization and the International Agency for the Prevention of Blindness, along with a lot of not-for-profit organizations and businesses and corporations. The Vision 2020 strategy elements are cost-effective disease control interventions, human resource development, which includes training and motivation, and infrastructure development of facilities, and here's a key phrase for today, appropriate technology, consumables, and funds. So these are the strategies they're trying to use to deal with the problem that has solutions. Vision 2020's guiding principles can be summarized by the acronym IC. Everything that we do should be integrated into existing healthcare systems. For too long, the services we've provided to children and others with vision problems have been separate from the general healthcare system. The services we provide and the things we do should be sustainable in terms of money and other resources, and they should be equitable. Care should be received by everyone, not just the wealthy. And the care should be marked by excellence, a high standard of care throughout. So this is a very lofty plan. Well, actually it has been successful in many places. And the Vision 2020 Right to Sight plan has now moved from just the World Health Organization and the International Agency for the Prevention of Blindness to the World Health Assemblies. This is a group that meets on a regular basis and is attended by the ministers of health of countries around the world. And so you take this general plan that came from a group, a small group, and you now want it integrated into the healthcare systems of every country in the world. And we are now at that level. This plan has been discussed by the World Health Assemblies, and there are commitments in many countries around the world to get the care that is available to the right people who need it. And in fact, just recently, it's so new that you can still smell the fresh ink on it, the World Health Organization published a plan for universal eye health, a global action plan for the years 2014 through 2019. And it integrates all of these things we're talking about. So this is a global plan. It's very nice, but what does it mean for today? Well, The plan that we're going to be talking about today is the plan for the EBSAR initiative for detecting early problems of vision and getting children to the services that they need. So the EBSAR Foundation's national campaign for early detection of children's eye diseases using I Spy software in the GCC countries is a project that integrates the goals of Vision 2020 and the World Health Organization Global Action Plan. The EBSAR national campaign has features that are critically defined in WHO and in Vision 2020. First of all, it focuses on prevention through early intervention. So everything that we're going to be talking about today is looking at getting in as early as possible to prevent problems. This plan, the EBSAR plan, also addresses refractive error, which is a leading cause of vision impairment, and of critical importance. This is so important, and I'll tell you why. This plan, the EBSAR plan, is integrated into primary health care and into the education system. It's bringing these two great fields together, and it's using the education system as a gateway into health care for children. This may not sound very important, but there are so few places in the world where this is actually done, where the universal education system, which is available to just about every child, is used as this gateway. A problem is found, but the most significant thing in this project is that there is then a link into a primary health care system where once you identify a problem, you're going to be able to do something about it. The next thing is that this project accumulates data to define the scope of the vision problem countrywide, and it provides baseline data which can be used to measure the impact of vision screening, which you're going to be hearing a lot about. In addition, the program we're going to be talking about today is easily replicable, it's cost-effective, and it's sustainable. So to sum up, vision care makes a difference. Vision impairment can create a very difficult life situation. It requires early detection, and of greatest importance, effective early vision care must be part of primary healthcare systems, and using an education gateway is an ideal way to do it. So, the EBSAR Foundation's national campaign for early detection of children's eye disease using I Spy software in the GCC countries as part of the shared global plan is an investment in life, livelihoods, learning, and living for all of the region's children. Now, go on. Go right into this. Now, I said at the beginning of my Power of a Shared Plan presentation that I was going to talk to you about a global plan, a national plan, and then finally, how you and I can be part of improving children's lives. I've told you about the global plan, I told you about a little about the national plan. Now I want to talk about the part that you, everyone in this room, if you're here, I'm hoping this means that you are committed to being part of the team to share in planning and doing something about this problem. So I want to talk a little bit about the part that you and I can play in improving the lives of children in the kingdom and in the region. And to do this, I have to look a bit more closely at the problem. Remember I said we have to start with the problem. So I have to look at the problem of vision impairment and see what that does to children. So first of all, Vision is critical to children's development because it's the major sense that they use to gather information about the world. They don't read books in the beginning about the world. They get out there in the sandbox, and through their interaction, they learn about the world. It provides the stimulus, vision provides the stimulus that draws them into acting upon their world. And it is through acting upon the world that they learn. They learn that if they take the lid off this, if I take the lid off of a bottle and I turn it upside down, something's going to happen. And they don't learn that by being just told that. But everybody that has a little child in their family or has been with a little child know that they find out about how things happen by taking things apart, boom, and they're finding out about the world by doing. Well, if you don't have vision and you don't even know that there's something out there that you can sort of get into trouble with, then you don't learn about the world. And when a child cannot see well or at all, much of the interaction with the world may not occur. Okay. So there are at least 4 ways in which vision loss can limit development. Children with vision impairment don't receive complete information about the world. They don't know what might be there for them. They don't have full, clear vision to motivate them to get into trouble the way I do, to bump into microphones and things and find out that I can make a sound like that. And they may lose control over their physical and social environment because they don't know what the opportunities are. And finally, and this is really quite sad, when they don't have vision or they have a vision problem, they can be constrained or limited by other people's expectations. Too often, a child or anyone with an impairment is not given the opportunity to develop fully because people are maybe trying to be kind or they feel sorry and they say, oh, don't do that, I'll take care of it, or it's okay, I can take care of it. And the child starts to believe that they can't do things. So it's a very interesting thing. A little thing like a visual impairment can impact all parts of your life. And so as a result of these simple 4 factors that I just listed, every developmental area in the child's life can be affected. In the physical realm, their strength, coordination, and range of motor development may be effective. If you don't know there's something over there to crawl to, you don't crawl, and then you don't develop the muscles and coordination you need to crawl, to stand, to walk, to be effective in moving about. In the cognitive area, the range and depth of concepts may be limited, because if you haven't acted on the world, you don't know the possibilities of the world. You don't know much about concepts or little about the concepts of the world. And finally, in the social area, you may lack information because you don't see it or get feedback about what's going on in a social context, and therefore you may have problems making friends, interacting with others, or knowing what to do in a social situation. Most of what we know about social interaction we learn through the peripheral vision that we're not even thinking about, that we're picking up signals from the room. For instance, when I look around the room, even though I can't see all the way to the back of the room, I can see some of you back there, so don't think you can go to sleep. I can see you. But I'm getting social interaction cues from the room as I'm speaking. I can see someone smile, I can see someone slide down like they're not interested. And that kind of feedback you don't get if you don't have full vision. So every area can be affected. So in summary, there's this kind of cycle that takes place when you have a visual impairment. First of all, at the top of the cycle, think of it like the wheel here. If you don't get full information about what's going on because you don't see it, you don't interact, you don't move out into the world and try things out. And if you don't move out into the world and try things out, the concepts you have about the world may become limited, and you're not really understanding what's going on. And when you don't understand what's going on, either in the social or cognitive realm, you may do things that are inappropriate or ineffective. And when you do things that are inappropriate or ineffective, it causes problems for you, and sometimes if you're visually impaired, people don't give you feedback about it, and so your concepts get more and more confused, and you go around and around and around, and you can't get out of that cycle. So we have to do something about that. And there are steps that can be taken to help children with impaired vision to develop their capabilities as fully as possible. Vision care professionals, like many of you in the room, teachers who are also here today, nurses and others, along with parents, can teach the child the needed skills that are usually acquired through vision. They can make changes in the physical or social environment so that the child can interact more fully. And they can assist families to get the kind of help that they need to address the complex issues associated with childhood visual impairment, so they don't become overwhelmed and give up. Now, put on the next slide and just take a look. It's a very, very simple slide. 2 pictures, a couple of words. But I'm leaving it on here for a moment because, believe it or not, this slide is the key to addressing the problem. This is where you and I come into the situation to make a difference. The cycle of impeded development can be broken if vision impairment is found as soon as possible. Here's the key. You have to know that there is a problem as soon as you possibly can, and that's the only way to break the cycle. Remember I said at the beginning, we know that there's a problem. It's huge. We have the treatments that we need for dealing with most of the problems. We have the tools that we need. Where is the breakdown? The breakdown is in finding the problem early enough. And that's what we're talking about today. Okay. So as I said, today we have the techniques, we have the tools to enable youngsters with impaired vision to enjoy childhood, to learn effectively and grow into productive, effective, capable adults. But we can only do this if we have accurate information about their vision and a system for referring them for any care that is required. The EBSAR Early Detection Project will enable vision care professionals, teachers, and families to assist children throughout the region to develop to their fullest. So, here's the challenge. The members of the EBSAR Early Detection Project team look forward to working with you to find vision problems in children as soon as possible so that children throughout the kingdom and the region can reach their potential. I wasn't exaggerating when I started at the beginning. I said, you can make a difference in the lives of hundreds of children, then thousands of children, then millions of children by bridging that little gap in the system between the child and services by finding the problem and finding it early enough. join us in this endeavor. Thank you.
Thank you so much, Dr. Marian. I'm going to call Dr. Sarfaraz Khan to the podium right now because he's going to tell us something about the prevalence and incidence of vision problems in children in the region.
Assalamu alaikum wa rahmatullahi wa barakatuh. You have to, that connection may be loose there. It's not there. Oh, yes. Indeed, it's a great honor and pleasure for me to be a part of this campaign, and I would like to take this opportunity to thank Dr. Marianne Lang. Oh, sorry. Oh, you are a very powerful lady. You can shake this. And Dr. Karen Seidman from North Star Vision Group, and also Mr. Muhammad Tawfiq Billo, the Secretary General of the Afsar Foundation, for giving me this opportunity to present a talk on prevalence of eye diseases in the region. It has been reported that there are 1.5 million children suffering from blindness in the world, and of these, 2/3 can be found in Asia. In terms of economic impact, it contributes to 75 years of blindness. This clearly suggests that there is a significant burden of childhood blindness in the region. It has been also reported that only 3% of the visually impaired children in developing countries have access to low vision care, and 50% of the visually impaired children in the special schools for the blind and integrated programs were having low vision. As we all know that population-based data is important to understand the burden of visual impairment and also to develop effective prevention and intervention strategies. Unfortunately, there is very little data available in many of the countries in the region, and today I'm going to present the data from the reports, published reports from the population-based studies, the schools for the blind, and also from the hospital records. The data compiled from 3 studies in the EMR region reported retinal diseases as the leading cause of blindness and was found among 38% of the children. And cataract was reported in 1/5 of the children. The first population-based survey conducted by Dr. Tabara et al. In the Kingdom reported a visual impairment of 1.2% and blindness as 0.2% among the children which were surveyed. This survey also clearly suggests that the burden of visual impairment is greater than the blindness. When you look at the causes of visual impairment, you will notice that more than 80% of the children needed spectacle corrections. This clearly indicates that there is a need for effective vision screening programs in the region. The data from the referral eye center also reported that refractive errors as one of the leading causes of visual impairment among children. The population-based data on causes of blindness reported congenital ocular abnormalities in more than half of the children, and retinal pigmentary degeneration was reported among 1 in 4 children. This study, which was conducted by Al-Raji et al. To assess the causes of blindness among children attending the special schools for the blind, found that the retinal diseases were again the leading causes of blindness. It was also reported that the congenital and hereditary eye diseases were the most common etiological categories of childhood blindness. And what is important for us, and if you see that the acquired diseases were only among the 11% of the children. In this study, which was conducted by Tabara et al. In the schools for the blind, reported that congenital cataract and primary retinal degeneration were the leading causes of blindness among the children. Among the children with genetic eye diseases, the parental consanguinity was 56%. And if you look at the acquired diseases, children with acquired diseases, it was only 14%. So this also suggested that there is a need to create, awareness programs about the interfamily marriages and what the ill effects of that. When we look at the data from a referral eye center, it shows that optic nerve diseases and retinal disorders as the leading causes of blindness. Another significant finding was the prevalence of genetic eye diseases among 70% of the children. When we try to look at our own data at Apsar Low Vision Clinic, we found that retinitis pigmentosa and optic atrophy were the leading causes among children referred for low vision services. Optic atrophy and hereditary macular diseases were the other common causes. Even a study which was conducted in Bahrain at the schools for the blind by Alawi et al. Reported that retinal diseases was the leading cause of blindness. The result of this study is comparable with the similar studies which are carried out in the kingdom. This study from Kuwait reported congenital glaucoma, primary retinopathy as the leading causes of childhood blindness, and cataract was reported among 13.5% of the children. If you look carefully at the data of a study which was conducted in Yemen, you will notice that trauma was reported as the second most common cause of blindness among the children who were attending the special schools for the blind. So this again clearly indicates the need for creating awareness among the parents. Coming to the conclusion, refractive errors was reported as the leading cause of visual impairment among more than 80% of the children. So there is a need for effective vision screening programs to reduce the burden of visual impairment. Thank you very much for your attention. Any questions? So it was clear. Thank you.
So I want to thank Dr. Khan for your presentation. And now we've laid the groundwork for the discussion that we're going to start now about the vision screening program, I Spy. We've had a call to action by Dr. Marian, an identification of the problem, and now we're going to see the beginning of our introduction to the I Spy vision screening software. So Mr. Rich Terendi is going to tell us about this exciting program.
Can you put it up, please? If I have technical problems, I'm not sure who to call. Thank you for the extraordinary privilege and honor to come here and share with you iSpy 2020. By a show of hands or whatever you prefer, how many of you like video games? Anybody? Thank you. How about your kids? Do your kids like video games? Well, I'm excited to talk to you about a video game. This computer's gonna not work for me, is it? Maybe I'll just hold this. Who thought that the biggest technical issue would be gravity? No, it's fine. Oh no, it's fine. I don't want to slow things down. Does this work? Is that on? Great. Turn it off. Yeah. Okay, can you still hear me? All right, great. Thanks for being patient with me. So anyway, I'm very excited to share with you a video game that, unlike other video games that we're all familiar with, this one doesn't take a whole lot of time out of the child's life, and it actually has the ability to change the child's life forever. So the stage was set. There was a lot of discussion about the global awareness and efforts around vision, the importance of vision. I want to talk about vision screening a little bit just from my perspective, the what, the why, and the how. So the purpose of vision screening is to do one thing, and that is to identify children that need to be seen by an eye care professional. It's not to diagnose. So I'm a guy that works not with words but with pictures, so this is my way of explaining this. We have a group of children, and what we're trying to do is identify those children that need to be seen by the eye doctor. Not all of them can go to an eye doctor every year, right? So this is why we vision screen. We identify those children, we send them to the professional, and that's where they receive the diagnosis and treatment that they need. I think Dr. Lang did a great job talking about why we vision screen. I mean, vision problems are extraordinarily prevalent. Depending on the age group that you're looking at, up to 1 in 4 children has a vision problem. Marianne also did a fantastic job, thank you for that, talking about the severity of vision disorders in children, the tremendous impact that it has on children academically, athletically, psychosocially, and ultimately economically. The good news is that it is treatable in most cases. And so we're talking about corrective lenses or in some cases surgery, but the good news is that all of you can work your magic and help these children if you just know the children that need the help. That's the key. And of course, like we talked about, the impact is astronomical. So what I want to share with you eventually, hopefully very quickly, is that there's a way to have a tremendous impact on many children. So the way that screening has been done, I think, is through a very, very, it's been traditionally a very complicated process. There's been a lot of research and science that has very carefully studied and documented the protocols, the processes, the rules that must be adhered to with great precision and consistency in order to get reliable results. We don't want to be referring children to an eye doctor when they don't have a vision problem. And at the same time, we don't want to be informing parents that their children don't have a vision problem when in fact they do. So although it's a very complicated process, it's very important that we adhere to this. So as a result, there's a tremendous amount of training, in fact, certification processes that are required in order to be a certified vision screener. Part of what you do when you conduct a vision screening is you carefully observe the child. Because one of the things that can happen during a vision screening process is that the children memorize the wall chart. So you have them cover up one eye, and by the time you have them cover up the other eye, they've already memorized the chart. And I've seen that many times. The human interpretation is also a huge variable. So while all of you may be highly trained, highly educated, certified individuals, everyone might do the vision screening just a little bit different, and that impacts the data. Another responsibility of a vision screener is generating the vision screening report to go home to the parents or to the teachers and inform them of the results. And then the last thing is record keeping, preferably for epidemiologic studies, but even just for record keeping for schools or parents. So vision screening is critically important because, as you all know, a child's vision can change very, very quickly, and therefore we must vision screen children, every child, every year. We just don't vision screen a child once and say they're good to go. They could have a vision problem, and remember, some of those vision problems can lead to irreversible vision loss. So it's not their responsibility to tell us that they can't see because they might not know. From the child's perspective, if their world has always been blurry, they have no way of saying it's blurry. That's all they know. So this is critically important, and at the end of the day, the reason why it's important is because every child deserves to see. Because it's so important, I was privileged to work with a group of medical experts, and we sat down and we asked ourselves the question, what does the ideal vision screening program look like? Not even just the technology, but what does a program, a model program, what are the qualities or characteristics of such a program? Well, it obviously has to be accurate. That goes without saying. That's probably priority number one, or at least should be. It also has to be accessible. It doesn't do anybody any good if you develop a magic wand that can't be distributed or get in front of many, many children in order to actually do the screening. It has to be very easy to use because at the end of the day, if it requires a tremendous amount of training and certification, then how do you differentiate that from the traditional vision screening methods? Ideally, it also manages the reporting and data requirements that are part of a comprehensive vision screening program. And then again, at the end of the day, if it does all these things for you, then it'll save you time. And that's very important because when you're talking about vision screening one child, saving time's not a big deal. Talk about screening 1 or 2 million children, every second matters. So with that, I want to introduce iSpy 2020, which is the video game that I referred to on the onset. And I'm going to be showing you the video game in detail in just a few minutes, but right now I'm just going to talk about it more qualitatively. Here is, if it'll start, this is a video of a child actually playing iSpy. You'll see this in person shortly. But from the child's perspective, they are playing a very simple matching game. That's all it is from their perspective. And again, I'll be demoing this live for you, so you'll get to see all of this, and it does the reporting that we talked about and collects the data. I'll show you that in just a second. So although I Spy 2020 is a game, it possesses the characteristics, it has the characteristics that we defined earlier of an ideal vision screening program. By the way, the fact that it's a game is not accidental, because you get an improvement in accuracy when you engage the child, psychosocially engage the child, and they want to participate. It removes the fear that they have of getting a vision test. In fact, we never call it a vision test, we call it a game for that very reason. So I'll talk about the accuracy very quickly. The video game was sent for independent scientific validation, and they came back with their results, and they said, I Spy screening results using a patch, which we use, were not significantly different than those of a professional examination. So the accuracy of this vision screening method is extraordinarily high. Excuse me. So it has to be accessible as well. Because it is primarily software, and I'm going to talk later more specifically about the supplies that are used in order to conduct a vision screening. In fact, you'll see them in use up here. But the technology is primarily software, so it's distributed and maintained via the internet. Obviously, very easy to propagate globally. It utilizes existing infrastructure, that being the internet itself, as well as off-the-shelf laptop computers. You don't need any specialized hardware when it comes to the computer itself. It requires a minimal amount of training and supplies, and the good news is you don't need an examination room in order to conduct the vision screening. So this is about how easy it is to administer, and you'll see me do this in a few minutes. You put a laptop on the table, you connect a cable with a mouse, you position the child 3 meters away, you type in the child's name, and then you just follow the instructions that pop up on the screen. I know that seems extraordinarily simple, and that's the intent. The software has all of the complexity of the scientifically validated protocols built in. It does the thinking for you. That's the advantage. So I want to talk a little bit about how we manage and report the data. Every single vision screening automatically collects the data and uploads it into the cloud via the internet. Everything is secure, and only the school or the organization that conducts the vision screening has access to the vision screening data. Everything is HIPAA compliant. The advantage to having this data now up in the cloud is that you have the data there forever. So you can now go back at any point in time and pull down any individual screening. You can generate summary reports. You can export the data into Excel if you want to do some epidemiologic studies over there. And of course, if you have your own data systems, you can bring it into your own databases and do what is truly unprecedented analysis. So very quickly talk about how it saves time in the interest of saving time. It takes, on the high side, it takes between 2 or 3 minutes to type in all of the child's information. And then it takes the child between 2 or 3 minutes to play the game. So if you do that, 6 minutes per student, you end up with 10 students per hour per laptop. And I know that sounds or may sound unbelievable, but you're going to witness this yourself. And I want to point something out. We're not just looking at visual acuity, and we're assessing the child's threshold visual acuity, but we're also looking at their color vision and also at their stereopsis or depth perception. And we're able to do this. So if I had 4 laptops, I can do 40 children an hour, 200 to 300 children in one day. So obviously, it's an extraordinary privilege to be a part of this national campaign of EBSAR. And I can't say enough, like I said, what a privilege it is to be up here talking about the program and its integration into this campaign. Very excited to be screening millions of children here. And this is really a historic first. A little bit of background. iSpy has been used to screen about 400,000 children in the States, but it is not implemented on a national level. And there's many reasons for that, not the least of which is that that's not allowed. Everything is done by individual states, not at the federal level when it comes to vision screening. So here's what's really exciting. Saudi Arabia, the Kingdom of Saudi Arabia, this will be the first implementation on a national scale anywhere on the planet, right here. And in fact, all of you in this room will be the first to learn how to use iSpy 2020 in the kingdom. So from my perspective, and hopefully from yours, but it's truly historic first. So this is what's coming up next. I think we're going to do this perhaps after the break. Okay, we'll have Chris Greening come up and talk in a minute.
Yeah.
But just so that you know, after the break coming up in about 15 minutes, we're going to do a live demonstration here up on the stage, and then we're going to jump right into hands-on training where all of you are going to be able to participate, I hope, if you want. Answer any questions that you might have, and then go into some of the details about the program. That's our national campaign.
I don't know what's with these guys. Coughing, coughing, coughing. So I hope you got a little interested in iSpy from that discussion. We're going to go into it in a lot more detail. I did not get to introduce you before to Mr. Chris Greening, who is the general manager of the company called Good Light. They are the exclusive worldwide distributor of iSpy. And if any of you stopped at the booth we had upstairs in the exhibit hall, you also saw that the Good Light Company has a lot of different equipment and materials for assessing vision. So here is Mr. Greening.
Hello, everybody.
You're not
it's
on.
a great honor and privilege, much like Rich,
You're not,
to be here.
you're not on.
Hello? There we go. Hi, everybody. It's a great privilege and honor to be here. This is my 4th trip to Jeddah, and it's starting to feel like home. I'm knowing my way around. I see many familiar faces out here in the crowd. As Rich said, this is a historic first that we can get this implemented nationwide. And we are really looking forward to doing whatever we need to do to make this happen here. So thank you very much.
Chris, you're very modest, but he gets up there and just, we're very happy to be involved. But Chris Greening and the Good Light Corporation have been involved here at EBSAR with all kinds of training. And Chris and Good Light have made equipment, charts, all kinds of wonderful things available to promote the work that EBSAR is doing, and is a key person in helping with this campaign and the iSpy materials for the campaign. So Chris, even though you're very modest about what you're doing, I want everybody to know the significant role that you play. Thank you.
Before we take a break, which we're going to do in a few minutes, let me ask if there are any questions for any of the presenters so far. If you have questions about iSpy, I know that they're going to be answered as we go along, but questions for Dr. Marian, questions for Dr. Musa, Dr. Khan. And yes, let me get a microphone over to you.
Thank you for all the presenter. First of all, I would like to ask Dr. Richard about the SPY program, comparing the result of the screening to the standard screening result, comparable to it. How accurate is it? And also, repeatable is the test, repeatable if done by other colleagues?
Thank you for the question. Sensitivity and specificity are 88 and 89% respectively. I can provide you a copy of this independent scientific study with all of the information that I showed up on the screen. As far as repeatability from screener or person to person administering the test, very repeatable, because the amount of knowledge needed to, I'm speaking about technical knowledge, you don't really need technical knowledge in order to administer the test. You enter the child's information in, and then the iSpy 2020 program will customize each test for that specific child and actually adjust itself in real time, so you get a very consistent result regardless of the person administering the test. And it is customized based on the child's age and also, like I said, the responses of the child in real time. But if you would like any additional information, please see me and I will get you a copy of the study.
Thank you.
Anyone else? Can I just ask with a show of hands, how many of you have been involved in a screening in the past? Conducted a screening, worked on a screening? 1, 2, 3, 4, 5, 6, 7. Okay, great. Good. It's good for us to know. Okay, so we are going to take a break. And yeah, we're early. If we come back at 4. May I ask you folks, we're a little bit ahead of our schedule, so we'd like to take a half-hour break. If I have you come back at 4, is that good for you? 4 o'clock works? Okay, so we have a prayer break and a coffee break, and we'll see you back here at 4. And I want to remind you that what's going to be happening when you come back is that we will have a live demonstration up here of Mr. Rich having a child go through play the game. I was going to say test. Play the game, and you'll be able to see that happen. So we'll see you in half an hour at 4 o'clock. Thank you.